So what are the pros and cons to receiving cognitive behavioral therapy? Starting off with the pros, patients develop skills to implement into their everyday life as well as coping strategies, and engages the individual in their treatment and provides a sense of control. Kumari in 2011 found that positive symptoms were reduced due to decreased activation of frontal, occipital, and thalamic areas in the brain through processing threat in a less fearful way. So just the way patients would look at a threat completely changed their positive symptoms that they were experiencing. I thought that was pretty cool. And the last pro that I will mention is it gives individuals the opportunity to involve others in their support. So helps them to feel less alone, more supported, involving family and friends to help them get through this. Now moving into the cons. One of the things with cognitive behavioral therapy that can be difficult for some people is that you first have to accept that there is a problem that is happening, and you have to be willing to put in the time and effort necessary for it to work. It's not like taking a pill and it does the work for you. You have to actively be ready to face uncomfortable conversations and really open up and be honest with yourself and be able to put in the work necessary to change that and to see the difference that it can make. Along with that, another con is the time commitment that it can take, because patients typically meet with their therapists between once or twice a week, depending on the individual. And that can be a lot to manage into somebody's schedule. Not everybody has the time or money for that, which is fair, but it's just something you have to weigh out when looking at the different treatments that you could face.